Welcome to the program, The Mailbox. Good afternoon. You're live here on Love 101 at the family station. This is Pastor Courtney Morrison here with you this afternoon. Welcome, welcome, welcome. Today is the 21st day of September 2022, and we're here to share with you on The Mailbox all that we want to share with you. It is the family station, Love 101, and it is National Sickle Cell Awareness Month. 2 weeks ago, we dealt with prostate cancer in males, and we also dealt with the issue of suicide prevention. Today, we're dealing with sickle cell, and it is National Sickle Cell Awareness. Good afternoon to everyone listening in and viewing us by Facebook and by YouTube. We want to say thanks, and we continue to say thanks to sponsors, Fosrich Company Limited, your electrical, solar, and lighting people. Today's topic, sickle cell disease in boys and men. The male parent story, male patient story, sorry. We want to give you an insight as to what is happening here. Persons with sickle cell, we have with us Oneil Lewis, a sickle cell warrior. He's a first-year student at University of Technology, pursuing a bachelor's degree in pharmacology. We also have with us today Noel Bell. He's a conceptualizer and film director of Jamaica's featured documentary on sickle cell disease called Beyond the Pain, Stories of Strength, Survival, and Spirit. He holds a degree in philosophy with a minor in media. Bell serves as Vice President of Marketing and Communication for the Sickle Cell Support Foundation of Jamaica as well. He has built his life as a professional photographer and cinematographer while living with sickle cell disease, and lives by his philosophy, I am because we are Ubuntu. Yes. We also have with us Professor Marvin Reed. He's the Deputy Dean for Research in the Faculty of Medical Science at the University of the West Indies, former director of the Sickle Cell Unit. So good afternoon to these three gentlemen. We will have them as our guests today. And today, I want us to say a hearty good afternoon to these three gentlemen. I myself, I'm not one who has the full-blown disease, but I do have the trait, and I have suffered from a sickle cell crisis while I was in third form at KC. Gentlemen, Professor, good afternoon. Glad to have you. Happy you could have come and is able to share with us this afternoon on the program as we look at National Sickle Cell Awareness. It is the month of September. The month of September seemed to have so much cancer, suicide prevention, sickle cell, so much to talk about. I want to invite those who are also listening. Gentlemen, good afternoon, good afternoon. I was awaiting a little response there, not hearing from you. I
Good
hope you're
afternoon.
well.
Good afternoon. Can you hear me? This is Professor
I'm
Reed.
hearing you quite well, Prof.
Good
Gentlemen.
afternoon. You hear me?
Oh, yes, I'm hearing you. You are Noel Bell, I hope.
Yes, I'm Noel Bell. Yeah.
There you go. My guess
Good
is good.
afternoon.
Good afternoon, sir.
You
How
hearing me?
are you, Oneil? Good to have you with us. We want to say to our listeners and those viewing us on YouTube that the program is live. And this is the mailbox, what we have been going on for the past 10 years. And as such, we want to continue to celebrate this decade with some life-changing information and programs. So those on Facebook and YouTube, you can look for us at Love 101 FM. Men, 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 and this is a male program. You can give us a call at 876-968-8327 or 876-968-8328. Ladies, remember, we appreciate you, we love you. But this is a male program, not a female program, a male. And so we are asking you to give us your comments via Facebook or YouTube or via our WhatsApp line, which is 876 997-3125. Gentlemen, we're going to have a great time with your information sharing, and I'm sure many persons will become more aware of what this is about. And as such, we want to ensure that everyone becomes fully knowledgeable on what is sickle cell, the sickle cell disease, especially affecting our boys and men. And so, Professor, I want to start with you this afternoon. Indeed,
Sure.
to
I'm
ask
happy
the
to start.
question. You have the title of professor, so I'm sure you are the one who is most knowledgeable on this aspect as the disease. What is sickle cell disease? What is the sickle cell disease? And does it go by any other name?
Sure. In different cultures, there may be different names attached to it. Most of it is revolving around the major symptom that people may complain of, which is that of pain. Um, the the sickle cell disease is really a collection, it's a group of illnesses that are characterized by the fact that individuals have an abnormal hemoglobin in their blood called hemoglobin S. And this hemoglobin doesn't function like normal hemoglobin. So, hemoglobin is a chemical that is in the blood and it transports oxygen all over the body. So, it's a very important chemical for you to have and for it to work properly and for it to have proper structure. So in sickle cell disease, typically what happens is that they have their normal hemoglobin being replaced by an abnormal hemoglobin called hemoglobin S. And because of this, they are likely to suffer certain problems. Pain being one, they may become jaundice, which is yellowing of the eyes. As a matter of fact, all organ systems in the body may be affected as a result of them having this abnormal hemoglobin. It's a genetic disorder, so you can't get it by touching, you can't get it by intimacy, kissing, or anything like that. It's transmitted through families because of the transmission of an abnormal gene from one parent. Um, so you have to have both parents having at least a trait for you to end up with the full-blown sickle cell disease. I heard in your preamble that you had two unfortunate occurrences. One is that painful incident at about grade 9, and the other unfortunate occurrence is that you happen to have attended KC, but we'll discuss that later.
Very funny, sir. I was trying to figure out what that second incident was. But yes, I was diagnosed that there are pains in my joints, and I was in the swimming pool at the National Stadium at the time, and I coiled up into a ball. Fortunately, I was seen. What is a sickle cell crisis, though? If you can explain to those who are listening and
All
some of
right,
those
so
effects experienced by those who
generally,
suffer from the disease.
persons with sickle cell disease will go through life basically just like any other human. But from time to time, they may have very periods of being very unwell. And those periods of being unwell occur whenever it is that the blood flow to specific areas, particularly the bones and some of the big organs, get slowed up because of blockage of the blood vessels. And this causes extreme pain. So, in short, sickle cell crises are usually acute episodes of really painful experiences that a person with sickle cell disease may have. And typically, the pains are usually in the big bones, the back, the hip, the upper arm, and so on. And it's really, 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 really intense pain. And in order to look after these pain, oftentimes they may need the assistance of a healthcare provider to give them extra fluids and some very strong painkillers to overcome this pain. Most times, most of the minor pains can be resolved by taking like standard acetaminophen, like as Panadol or Cetamol.
Yes.
But for the most part, when they really get bad pains, they really need some very powerful painkillers to alleviate the pain.
Uh, can a patient, can a sickle cell warrior, can someone who has the disease, is it life threatening? What percentage of persons go through their entire life? Does it shorten their life any at all?
So the short answer to that is with new advances in terms of how we treat the disease, the life expectancy for persons with the full-blown disease is increasing. In Jamaica, we have calculated that the typical life expectancy of someone with sickle cell disease is in their mid-50s, which is pretty good coming from in the older years group. 30, 40 years ago, it might be in their 20s. So we have made tremendous progress over the period. Can it be life threatening? It depends on the complication that they're experiencing. Some complications are actually more dangerous than others. And so, yes, typically when they go into a very bad crisis, which affects the lung, affects the liver, affects the spleen, affects the kidneys, some individuals may have a bad outcome. But as I said, treatments have improved tremendously over the last decade or so. So we do have some options. And hopefully, with the continued use of these options, we will see further improvement in the survival of persons with sickle cell disease.
Thank you, Doc, Professor Reed. Are there any physical characteristics that you can look at an individual and may come to the conclusion that they are one person with the sickle cell disease?
So the short answer is yes and no. So I'll say yes in the sense that oftentimes, especially if it is that they've had a bad course, they may have yellowing of the eyes. So one of the physical characteristics that you may note in someone with sickle cell disease is eye yellowing, which is the white part of the eyes becoming yellow. The other sometimes features that may be common in somebody with sickle cell disease is their build. Oftentimes, they tend to be relatively slim in build, and this may give some clues that they may have sickle cell disease. But broadly speaking, with as I said, especially now that we have started what we call early interventions from birth, almost, it's becoming more difficult to distinguish just by casual looking somebody who has sickle cell disease from somebody who doesn't.
Also, the disease therefore can be prevented, or
So
you
the
know,
short answer is again yes and no. Because it's a genetic disorder, the best way to prevent this is, of course, to ensure that persons, both male or female, who are producing children do not have, at least one of them should be fully normal, meaning not have any trait or don't have the sickle cell disease. So that's the best way because you need the abnormal gene from each parent in order for you to get a full-blown disorder. So that's the way to prevent it technically. Now, um, let's just say that an individual ends up having sickle cell disease at birth. We recognize that there are certain simple interventions that can be performed during the early years of the person's life to ensure that one, they do better in terms of being less sick, and it increases or improves their chances of living into a life and a nice ripe old age. So some of these interventions include ensuring that they get all their full vaccinations. In sickle cell disease, there's a particular vaccination that's important, and that's a pneumococcal vaccine. So we have to ensure that they get that relatively early. We have to ensure that we teach the parent at that time how to feel for their spleen so that in case the spleen gets enlarged, we can fix that quickly. We have to teach them how to manage their pains so that the pains are not as severe because that can lead to problems later on. And more recently, in some jurisdictions, they have actually put them on this drug called hydroxyurea from for as early as 6 months of age. And that seems to reduce a lot of their complications that they may have as they age. In other jurisdictions, depending on how severe they are, they may actually put them on what we call chronic transfusion therapy, where they get a transfusion every month. That also tends to improve their well-being and growth. So the short answer to your question is Prevention is due to knowing your status before you engage in relationships. That would help in terms of actual preventing. But if love is so strong that you decide to go ahead, and unfortunately a child is born with sickle cell disease, there are some precautions that you can do from very early, which can result in a better outcome over time.
Thank you. We're speaking with Professor Marvin Reed, Deputy Dean for Research in the Faculty of Medical Sciences at the University of the West Indies. He's a former director of the Sickle Cell Unit at UWI. One final question, Prof.
Sure.
Are there any must-know medical facts? Are there any special diets for someone who has the sickle cell disease?
All right. Before I answer that specifically, I just want to mention that I mentioned, and because it's a male program, there's one illness that is peculiar to men with sickle cell disease. So I just want to mention that up front, and that's a condition we call priapism. Priapism occurs whenever the male actually gets an erection that lasts for more than an hour or so. And oftentimes it may start just before puberty, and it may get worse during the pubertal years and in the early years. The significance of that is that it's a form of painful crisis. So the pathology or the underlying mechanism is similar to that which occurs for them to get bone pain. And so it's important that, one, we identify it early, and two, that we treat it relatively aggressively, because one of the long-term complications of that is it may get erectile dysfunctions, and then that in turn may interfere with them having fruitful relationships with in their young adulthood. So I just wanted to mention that because this is a male program. The other remind me again the other specific question that you had asked.
Medical facts and diet.
So on the
Are there
diet
special?
side, yes, on the diet side, what we recognize is that there are certain components of the diet which may be beneficial to persons with sickle cell disease. The components of the diet are foods that are rich in antioxidants, because that help reduce or mitigate some of the harmful effects that occurs when the sickling process occurs. So these are your typical fruits, which are going to, and your vegetables, which are going to be rich in your antioxidants. An element that is important for sickle cell persons, especially for those who have wounds and also for reproductive function, is going to be that of zinc, which you can get again from some of your green leafy vegetables and so on. The other thing that we find that is also useful for them is certain kinds of what we call amino acids, which are the components of protein. So in particular, what we call the sulfur amino acids. And so in order to get those, you need to ensure that you have a diet that has an adequate amount of protein, whichever your source of protein is. Some persons are meat folk, so you'll get that from meat. Some persons are vegetarian, so they will have to get that from their soy-based products. But the key important thing is that you really need to ensure that you have an adequate amount of protein to help replace, you know, to help with your growth and development. The things that we also try and do is that one of the features of sickle cell disease is that individuals become anemic. That is, their blood count falls. But we don't recommend that they take extra iron. So they're not supposed to be taking vitamin supplements or stuff that has iron in it, because that actually can make them more ill. We recommend that they can take the vitamin called folic acid to help maintain some of their blood count levels. But certainly, iron should only be used under the directions of a medical professional, because it can have untoward effects on them. So those are some of the broad principles or recommendations that we tend to make for persons who have sickle cell disease on the diet side.
When you say phosphorus, you say electrical. SWA cables, conduits, transformers, and breakers. When you say phosphorus, you say lighting, chandeliers, and more. When you say phosphorus, you say LEDs and solar water heaters. Phosphorus is electrical, lighting, solar, and LEDs. Visit us today, Kingston, Mandeville, and Montego Bay. Phosphorus. When you say phosphorus, you say electrical. SWA cables, conduits, transformers, and breakers. When you say phosphorus, you say lighting, chandeliers, and more. When you say phosphorus, you say LEDs and solar water heaters. Phosphorus is electrical, lighting, solar, and LEDs. Visit us today, Kingston, Mandeville, and Montego Bay. Phosphorus.
I'm Tammy.
I'm Wayne.
And we are the Mitchells. Our life is a busy vibe.
We have our vlogging and music.
Entertainment for the kids.
Them love the online gaming, you see.
And streaming enough shows.
So whether we are at home or on the road,
Flow Yard and Road is made for our vibe.
Power your everywhere vibe with Yard and Road and get up to 150 megabits per second fiber fast internet at home and fully loaded mobile with unlimited social and YouTube data. Anywhere talking text plus gigs and gigs of any use data. All for a special offer of $4,999 plus GCT. Yard and Road is for the way you live. Flow, Jamaica's network. Visit discoverflow.co. Conditions apply.
You love Grace Foods, come dance with me. Whether you are wild or you are pitney, we make everybody happy evidently. Grace in every house, in every country. Grace with the new dip, GK fit. Lead by your mind like a jockey with a whip. Talk to we nice, don't make your mouth slap. Grace move in the world, everybody knows. 100 lit, 100 years in every basket. 100 years of great friendship. Grace move in the world, everybody knows.
Grace, celebrating 100 years of taste that moves you.
Mommy, is who I ticket?
Hush, child. Me no want them see we.
But mommy, is the census takers?
Me not tell them my business.
But mommy, they need information about all the households to help make decisions about where to put things like clinics, stores, and new roads.
So?
Come, mommy. You count, me count, all of we count.
Census Day is September 12th. Look out for the national census takers in your community and let them know you count.
Oh, yay.
Welcome back to the program, The Mailbox. We're sorry and we apologize about that technical difficulty we experienced. We want to thank Professor Marvin Reed. There he is, he's back with us. He is with us. He's the Deputy Dean of Research in the Faculty of Medical Sciences at the University of the West Indies and former director of the Sickle Cell Unit at UWI. I don't know if we heard about that. I got kicked off, so.
Yes, I did speak a bit about that.
Good.
So it's
beautiful. So, Prof, it was our pleasure having you with us. Is there anything else you want to share just before we end your discussion and move on to these two young warriors, sickle cell warriors that we have with us this afternoon?
Yeah, I'm happy that you have entertained, as you call it, two young warriors. The take-home message is that sickle cell disease is not a death sentence, and your two young warriors is actually going to expound on that very, very well. So with the advance in terms of science and technology and in medicine, we do have lots of hope now for persons with sickle cell disease. So that's really my take-home message. It is not a death sentence, and there are ways and means of enjoying a full life.
Thank you very much, Professor Reed. Thank you for spending time with us here on the Mailbox, as it is Sickle Cell Awareness Month and we're discussing the disease in boys and men. You spoke about something that affected only the men. I hope we had our men listening in on that particular function that affects only us, or dysfunction. Thank you very much for being with us. I want to speak now with our two youngsters, Mr. Noel Bell and Mr. Oneil Lewis, two sickle cell warriors. Oneil here with us is a first-year student at University of Technology, pursuing a BSc degree in pharmacology. And Noel Bell is a film director. He's a photographer, vice president of the Sickle Cell Support Foundation of Jamaica. Gentlemen, good afternoon again. Thanks for being here with us. I want you all to both to take about 2.5 minutes to introduce yourself before we get into the meat of the matter and hear a bit more about your own lives and how you're battling this disease and how you have overcome. Want to start with you, Noel, firstly.
Hi, good evening, Sir Courtney and Oneil and the rest of Jamaica that's listening. All right. So as you said a while ago, I'm the VP of Marketing and Communication for the Sickle Cell Support Foundation. I'm also a graduate of the University of the West Indies, where I did a bachelor in philosophy and media studies. I've been living with sickle cell for the last 30 plus years. No, it's not a death sentence. It has had its ups and its downs. So as we go further into the program, I guess I'll share a little bit more on what it's been like living with this disease.
Thank you very much, Noel. Sir Lewis, tell us a bit more about you before we get into the meat of the matter.
Hi, good evening, everyone. I'm a first year student at the University of Technology of Jamaica. I'm studying my bachelor's in pharmacy. I'm a past student of the Cornwall College in St. James, so big up to Cornwall. And I'm just an hardworking young man living the sickle cell and living a normal life. So as we go down into the interview, I will expound more on how I'm battling with sickle cell disease.
Yes, so we have heard both from our two guests here, and we have heard some of the physical characteristics that are displayed. He said yes and no to some of them, yellowing of eyes. The stature may be slim in terms of how the person is built. Have either of you been through any of those pain care treatments that's necessary? Have the pain ever been so severe that you have ever become hospitalized? Noel?
It's an interesting question because I think as someone living with the illness, it's almost like it's automatic. The reason why I say that is sickle cell is a very variable disease where it doesn't affect everybody the same way. So each person may have different trigger factors, and for some it might be weather, for some it might be other stressful conditions. So to answer the question, yes, I believe earlier this year I had one of the most severe crises in my life where I was hospitalized for an entire week, and that's because of how the access to care was, where healthcare providers, they sometimes struggle to understand the magnitude of pain that you are in. So yes, and it can be debilitating when even the persons who are supposed to offer you care, they themselves don't fully understand. Or I think I use this term compassion fatigue, where they've gotten so used to seeing persons with sickle cell coming through the emergency room that they sometimes think that, oh, you're just here for medication. So I have had many crises over the 30 plus years that I have been living with the illness.
You are an overcomer, not just a survivor. I see a comment here from Yolanda Palmer. Go Noel and Oneil. So proud of you both for what you are doing and coming here to represent and speak about your own personal experiences. I'm going to be asking a bit more from you, Oneil, about the Sickle Cell Support Unit and what does that afford. We heard Sir Noel speaking to the fact that the matter of compassion and understanding seems to be needs heightening right at this stage. But we're going to take a commercial break and we're going to come right back to you, Oneil. So We're going to throw back to the studio, take a commercial break, and come right back with this informative, interesting discussion on sickle cell disease.
I'm Tammy.
I'm Wayne.
And we are the Mitchells. Our life is a busy vibe.
We have our vlogging and music.
Entertainment for the kids.
Them love the online gaming, you see.
And streaming enough shows.
So whether we are at home or on the road,
Flow Yard and Road is made for our vibe.
Power your everywhere vibe with Yard and Road and get up to 150 megabits per second fiber fast internet at home and fully loaded mobile with unlimited social and YouTube data. Anywhere talking text plus gigs and gigs of any use data. All for a special offer of $4,999 plus GCT. Yard and Road is for the way you live. Flow, Jamaica's network. Visit discoverflow.co. Conditions apply.
What you count, yeah. Hey, me count, you count. Census say all of we count. Hey, you count, me count. Census say all of we count. Hey, we are gonna start from east. Hey, then we reach a west. Hey, the process easy. Yo, please don't just start. Guess what? Census 2022.
The Jamaican census will be conducted between September and December 2022.
You count, me count. Census.
When you say phosphorus, you say electrical. SWA cables, conduits, transformers, and breakers. When you say phosphorus, you say lighting, chandeliers, and more. When you say phosphorus, you say LEDs and solar water heaters. Phosphorus is electrical, lighting, solar, and LEDs. Visit us today, Kingston, Mandeville, and Montego Bay. Phosphorus.
Crime Stop Jamaica 311 Unsolved. We need your help to solve the murder of 73-year-old Patrick Lawrence, a businessman and motel operator of 12 Top Road, St. Anne's Bay. A customer tried to rent a room at 10 p.m. on Saturday, 14th of May 2022, but couldn't find Mr. Lawrence. The police were summoned on Sunday morning, and Mr. Lawrence's body was discovered close to a staircase with wounds to his head. Crime Stop and concerned citizens are offering a total reward of $750,000 for information leading to an arrest and charge. Call Crime Stop Jamaica 311. Solving crime pays.
Grace, celebrating 100 years of taste that moves you.
The time by Grace Foods is...
It's now 3 minutes past the hour 6 right here on Love 101. You're listening to the program, The Mailbox. I'm Pastor Courtney Morrison. I'll be with you for the rest of the month. Kevin will return in October. But today we're speaking on the topic of sickle cell disease in boys and men. How does it affect them? And we have with us two sickle cell warriors. Noel Bell, he's a film director, photographer, and vice president of the Sickle Cell Support Foundation of Jamaica. And Mr. Oneil Lewis, who is also here with us. He's a first-year student at the University of Technology, pursuing a BSc degree in pharmacology. We just spoke with Noel just before the break. Sir Lewis, tell us a bit about your own experience before we talk a little bit about the Sickle Cell Support Unit.
So my experience with living with sickle cell disease is mostly from when I was younger, where about age 4 to about age 9, we have been hospitalized most of the times, being on the ward for like 2 weeks. We have severe chest pain, severe joint pain, and eye fever as well. So this was due to a lack of knowledge about the disease. So I encountered numerous crises, and now I don't really have much crisis as I used to. So that's my experience with the disease.
Good. We have some words of encouragement here, as we said. Yolanda Palmer says, go Noel and Oneil. So proud of you both. And one other person, Marjo Mundell from Longville Park in Clarendon, says, it can't be easy for you guys. Just push and you will overcome. Keep hydrated, diet, watch your activities. Have you received your hydroxyurea and vaccine? I wish you all the best. A gentleman encouragement. I knew a sickle too while I was working at a particular retail store, and he wasn't doing so well, but indeed we saw where he overcame, and with treatment, he did well. Another individual here says, pleasant good afternoon, everyone. My daughter is a sickler. She's in her 30s now. I give God thanks every single minute because of what he has done and is still doing. She has been through so much, but God. She's doing her degree in social work at the University of the West Indies. There's no stopping. They are real warriors. Gentlemen, did this affect, I'm going to come back to the sickle cell support, but did this affect your studies in any way? How did you get past it? As we have that listener talking about her own daughter going through the crisis, has this, Noel, affected your studies in any way? How did you get past it? And the same question for you, Oneil, when he's through.
All right. So it's a good question, and so let me just provide a little bit more context for those who aren't familiar with what a crisis is. So a crisis is really a painful episode. And as Oneil would have said that, it comes with fever. It's in the joint, it's in the muscle. Sometimes you can have organ failure because of the severity of the crisis. So in terms of education, now there are many patients living with the illness that because of how frequently they may have these crises, it causes them to be out of school for an extended period. And adding to that is sometimes they get a condition of leg ulceration where they have ulcers on the foot and it sometimes takes a while to heal. So that also puts a limitation on education. In context of myself now, I've had moments where I've been out of school in my younger years, and I can reflect on the high school years where it was very challenging to um, stay up with the rest of the students that never had many challenges in comparison to sickle cell. So there are days when you're out of school, you would be admitted, and then when you come back into the schooling system, you had to be in catch-up mode. So one of the things that we say as a foundation in terms of support for parents and teachers to really work closely together for a patient or someone that's living with sickle cell so that the notes that they can receive the notes, or even in their downtime, they can at least try and read through when the pain has break, so that they will not be so far behind. So to answer the question straightforward, yes, it has affected education because sometimes you're not as far with the rest of the class.
And yet you overcame and are successful at what you do. What an inspirational story. Oneil, a bit about your story and education and where you're at today.
So as it relates to sickle cell and my education, for me it was challenging because and I had to miss out on many classes and so forth, and probably most likely exams. During high school, I didn't, I wasn't hospitalized most of the times. I had numerous crises though. I had to miss schools for numerous days, and I had to play catch up, and I even missed out on exam and so forth. But I did so with the grace of God, and I did well.
Congratulations. You guys sound as if you have navigated the course well. Uh, to take it a bit further, I just want to latch on to what we were saying before. What support you had while you were going through these difficult periods in school, in relationships, if you have parental relationship, partner relationship, how did this affect that, and what levels of support were you given, and how important was that, Noel?
Okay. So support. So this is a big one, and I would not everyone has the same level of support. I was one of those persons that was fortunate to have a mother who was just on the ball as it relates to care and ensuring that she would do her best in terms of ensuring that even while I was going through a crisis, she would ensure that the diet is correct. Also, my dad played his part in terms of ensuring that I would get to the hospitals on time whenever I would be having a crisis. Because as we're talking about sickle cell, we cannot leave out the reality that it is a debilitating disease. So when you have a crisis, there are times when you can't even move. So sometimes you will need someone to lift you. There are times when you might need someone to help you go to a bathroom. You might need someone to just be there to ensure that you even take the medication on time because you get so weak, the pain is so bad. In terms of like friends now, I remember it just being a bit challenging in the younger days because I wasn't sure how to explain what I was going through because sometimes friends would be like, but you're always sick, what is going on? So when you didn't understand the science behind it in your younger years, it was hard to really share the information that persons could really understand the struggle that you were going through. Um, so support is a big part of persons living with the illness. You're going to need a lot of support, and it's not just support at age 10 or support at when you are only 15. It starts at birth. You're going to really need someone who understands, and if the first line of support can be family, then in my mind, I believe that it helps to navigate the illness a little bit better versus someone who doesn't really have that support system and they have to navigate it all by themselves. When they get to the emergency room, they have to be walking to go down to the registration department to register themselves. If they need to pass the urine, they have to find the bathroom all by themselves. So support is a big deal. And I was blessed to have good support in terms of family and friends along the way.
Thanks very much, Noel. Oneil, I mean, the difficulty navigating the throughout the sickle cell crisis and being a warrior and coming out at the other end. Did support play that vital role for you to overcome from those youthful days until now?
Well, I had a huge support, and it actually played a vital role in my life. I had support from my parents, my father, and my mother. They were the ones who were with me throughout hospital when I was hospitalized, through school, with my academics, my brothers as well, and even my aunts. There was the one supporting me when my parents wasn't around. I can remember my aunt, Auntie Carlet, taking care of me when I had numerous crises, high fevers, and so forth. And a lot of people that have sickle cell, they face a stigma of discrimination where they don't want others to know that they have sickle cell disease. So my friends, all of my friends know that I have sickle cell disease, and they support me, and that is why I love them. And there was the one with me, and friends, families, everyone, they support me, and this is why I'm here today.
Support is vital, especially being young men. How did you feel as a young man? You spoke about the discrimination, O'Neill. How were you able to overcome the discrimination although you had those who were supporting you? You encountered anyone who sort of was standoffish? How did that work for you?
No, I didn't have anyone that discriminate me in any way.
Awesome. Was that the same for you, Noel? Anyone looked at you differently?
Yeah, so I had, so my experience with living with sickle cell was both good and bad. And I think it was just out of ignorance why some of the discrimination was done. So I remember a particular, so you mentioned earlier about support in relationships. So I remember in my younger years, I was talking to this particular female and I explained to her what was really going on in my life. And when she shared with her aunt, her aunt basically said, "Oh, him going dead, and if you continue to live with him, it's going to be hell, and you're going to always be at the hospital with him." And just the constant stigma that this is a death sentence. And you can also talk about things that happen in your past, how people would treat you. So like even persons within the healthcare system where they would treat you as if you come to the hospital because you only want the drug. Most persons with sickle cell, they will tell you that the reason why we go to our emergency room is when the pain gets to a level where you can no longer take the painkillers that are prescribed to break the pain. That is when you actually want to go to the hospital. Another thing is you go to the hospital and the nurses, just their behavior sometimes, oh, you might sickle cell, Lord Jesus, and just the way in which there's just so much stigma there, the life sentence stigma. Sometimes, well, I was one of those persons that was teased because of the color of my eyes. You know, I can laugh about it now where I was called curry-eyed in high school and stuff like that. So most of the stigma that really plays on in our society now is a lack of ignorance and not enough persons know what sickle cell really is, because outside of the foundation and the sickle cell unit, there is not this great campaign that drives awareness about what sickle cell really is, and how does it affect a person. You're most likely to hear about sickle cell during the month of September or on World Sickle Cell Awareness Day. But there are even persons living with sickle cell that live up to the 80s and up to their 90s. So persons are living with the illness, persons are living a normal life. It's just for our wider society to understand what it is and how we create the balance in terms of supporting.
Thank you very much, Noel. We're going to be right back with our final segment right here on the mailbox. It's Sickle Cell Awareness Month. We're speaking with Noel Bell and Oneil Lewis, who is a first-year student at the University of Technology. We're talking about the stigmas. We're talking about the facts and the fictions. We had Professor Reed sharing with us. We're going to come right back right after these messages. Back with you shortly.
One total great tribulation, God put them in a white gown, down to the slaughter him wear the crown. Man of God, never you try to then we are family.
Hello, I'm Dr. Nadine Blair, Programs Manager at Love 101 FM, the family station. Here's a reminder, a soft answer turns away wrath, but you see them grievous words, them stir up the anger. Proverbs 15 verse 1. Before you respond, stop and think. Let's reignite the love.
Hello, neighbor. We are family.
You've been faithful.
Wycliffe Caribbean will be hosting its 10th annual Church Leaders Breakfast under the theme Passing the Baton Towards the Finish Line, Celebrating the Faithful. This Saturday, September 24, beginning at 8 a.m. at the Venetian Terra Nova Hotel, 17 Waterloo Road, Kingston 10. Listen as Love 101 FM will share highlights. Sponsored by Love 101 FM. That's the 10th annual Church Leaders Breakfast of Wycliffe Caribbean. The highlights will be this Saturday on Love 101 FM, the family station.
New mercies I see.
Welcome back to the program, The Mailbox. You're live here on Love 101, the family station. We continue to say thanks to Fosrich Company Limited, your electrical, solar, and lighting people who have sponsored this program. We say a big thank you. We have with us Noel Bell, film director, photographer, and vice president, the Sickle Cell Support Foundation of Jamaica, and Oneil Lewis, first-year student at the University of Technology, pursuing a bachelor's degree in pharmacology. They are both sickle cell warriors and have fought off the stigma attached and have also done battle with sickle cell crisis, but they are here today, still with us, in spite of and despite all that is happening. Oneil, were there any fears for you? You know, Noel spoke to the issue of persons talking about you might die and all that. Were there any fears for you? Are there still any fears? How is that going for you?
Oh, sorry for logging out as that. There is no light that you take right now. I have the support from my friends now with hotspot and light to be on here right now.
Excellent.
So about fear, no, most of the times I even forget that I have sickle cell. So There's no fear with me about a death or anything. I'm just living a normal life.
Very good. Noel, for you, you have moved from student to now vice president of the Sickle Cell Support Foundation of Jamaica. Tell us a bit, how did you get there and is helping out? What does the Sickle Cell Support Unit do for persons roundabout who has sickle cell disease?
All right. So my journey was, I'd like to say, I experienced two sides of the spectrum because I have to put it out there that not all persons living with sickle cell get the stories like myself and Oneil in terms of the good support and able to attain higher education. Because many of them, because of the severity of crisis and the leg ulceration, there is a high level of they don't mature they don't necessarily mature not mature they don't necessarily matriculate into higher education. So what happened is that you have a high incident rate of persons who they didn't finish high school. Sometimes the parents didn't even worry to let them finish primary school. So at the foundation now, this year we have launched our scholarship for persons living with the illness so that they can both finish high school and also attain some higher education. And this was only able to happen with the help of Grace Kennedy, the Grace Kennedy Foundation, and also the JMMB Foundation. So myself and Oneil, we do have the better stories. And with the Support Foundation right now, we are tasked with really just making as much lobbying and as much advocacy for the general population of persons living in with sickle cell in Jamaica. So for the last 30 years, through our lobby, we have lobbied with the government, and we are at a point where some of the medication for persons living with sickle cell is offered by the National Health Fund, so they can go to the pharmacy and get pain medication along with some other drugs such as hydroxyurea. So that's where we are right now. However, we still have a lot way to go in terms of awareness campaign, such as getting into the schools and making more awareness known, talking to parents, talking to teachers about how do you support a child with sickle cell, because it's not the same way as how you support the regular child. So even though myself and Oneil, we do have the better stories, we still have to also remember that there are those in the population that they didn't make it to the top like myself and Oneil. And it's not because of the lack of ability, it's just the lack of support to get them there.
Thanks very much, Noel. How inexpensive or expensive is it to receive treatment? I've heard of a young lady that I know who has spent millions in terms of care. She's in her 20s. What support does the Sickle Cell Foundation give? Is there a reduction in medical costs? Do these patients come to you? How do they get to the Sickle Cell Support Foundation unit? What do they need to do, especially those who have the severe case?
So what we have right now is that for the support, we have a group on WhatsApp, and the patients sometimes they will reach out to us and say, "Hey, this is the situation that is going on," and let me give you the realness of it. So there are patients who, because they are not educated, they can't find jobs that will allow them to work and to really provide for themselves. So sometimes they would reach out and they would say, "Hey, I don't have food." So sometimes we'd have to figure out a way to get them meal, which, when they're not eating, it's affecting their body. Sometimes they would reach out and they say, "Well, I got this prescription and the medication is X amount of money. I don't have the money." And the foundation has to chip in and to see where we can get the funding to assist them. It can be expensive because there are other complications that sickle cell lead up to, such as necrosis of the shoulders and the hip, where that is where the tissues that's within the ligament, it wears out because of the sickling that takes place there. And then what starts happening is that the bones start to rub on each other. So in a case like this, that patient sometimes is in constant pain and sometimes they need to do a hip replacement surgery. One of those hip replacement can cost up to 500,000. So this is not necessary. The surgery is free, but the prosthetic is something that we'd have to find the funding. Now the foundation itself, we don't have a lot of private sector here, now a lot of government funding. So we don't have a lot of money. Sometimes we raise the money by doing some symposium and just trying to reach out to other companies that can help with the sponsorship. So as it is right now, most of our work is just to get the medication from the government standpoint so that persons who need painkiller, they can get the painkiller.
Thank you very much, Noel. Have you been a beneficiary of this program, Oneil? Is it, or you have been able to, with support, afford medical treatment?
Yes, I've been a beneficiary of this program. I'm also a beneficiary from the Sickle Cell Support Scholarship Program. I was awarded 200,000 to pay for my tuition at UTech. So I'm
Excellent.
grateful for this with this support, and I'm able to continue my study. Um, doing so.
So
And
there's help out there for everyone. You care to
yeah,
give us that WhatsApp number? Is it that persons who are sicklers can just get that WhatsApp number, join the group, and be a part of it, Noel?
Yeah, so what they can do, they can reach out to me and they can be added to the group. So I can share that WhatsApp number that they can reach me at. It's 481-1787. So let me repeat that, 481-1787. And not only are we inviting persons with the illness, but we're asking also parents of persons living with the illness, even friends, if you want to be a part of that WhatsApp group, just so that you can learn, even if you may not necessarily know what sickle cell is. We invite you to join because we do need help in terms of awareness. It's a very small foundation and we need more hands on deck to get the news out there and to get the awareness out there.
Excellent, excellent. We have a couple of Facebook comments that we want to take to hear what persons are saying. So we're going to take those right now. We have Camille Daly saying, the Sickle Cell Support Foundation of Jamaica salutes our sickle cell heroes, Noel and Oneil. Congratulations to Oneil for winning one of our 30th anniversary sickle cell scholarships. Thank you. Angela Hackett says, I used to work at a hospital and I used to support them. I remember a child coming with pain. He cried so much. All I could do is cry too. That's empathy. Awesome. Jai Jet Life says, I always knew Oneil as a hardworking person. Proud of him. Keep it up, son. Comments are coming in good. Toshiba Wallen says, working with sickle cell disease patients make me actually feel their pain. What I prayed for and hope will change is how they are treated and stereotyped at hospitals by healthcare workers. Thank you, Toshiba. Keep pushing, son, Jai Jet Life says. Denise Brown says, blessing my fellow warriors. God is in control. Thank you, Denise. And so we're getting all these words of encouragement, from all around. And we thank you. Go, nephew. Proud of you, boy. One done masterpiece. I guess whoever is the nephew will know exactly who One Done Masterpiece is. So, final words of encouragement. I'm giving you 20 seconds each, encouraging someone out there, a male that may have the sickle cell disease. Just encourage someone for me, please. I'll start with you, Oneil.
okay. Words of encouragement. Do your research, get to know about sickle cell, and to take care of yourself and live a normal life and enjoy life and try to help others living with sickle cell.
Beautiful, beautiful. Thanks. Noel?
I'll piggyback on what Oneil said. Sickle cell is not a death sentence, men. We can live a full life if we take care of ourselves. Traditionally, men don't like to go to the hospital, but I'd encourage you, do your best to take care of yourself. And for the fathers who have sons or daughters with sickle cell, do your best just to support them as best as possible.
Bless you, bless you, bless you. We want to thank our producer, Tony K. Bromfield, Timoy Butler, for technical support. Both yourself, Oneil, and Noel Bell, and Professor Marvin Reed, who was with us earlier, Deputy Dean for Research and Faculty of Medical Science at University of the West Indies, for being here with us and sharing with us on this program about sickle cell awareness. Want to thank listeners, viewers, and participants. Thank you. We want you to like and share and leave your comments on our episodes on our YouTube channel. Previous episodes are viewable and available for viewing and note taking. Love 101 FM. I leave you with this quote. Nobody looks good in their darkest hour, but those are the hours that make us what we are. We stand strong or we cower. We emerge victorious, tempered by our trials, or fractured by a permanent damning fault line. Karen Marie Moning said that. This program is the program designed for men with guess who are men. I was your host, Courtney Morrison. Catch you next week, same place, same time. This was the Mailbox, sponsored by Fosrich Company Limited, your electrical, solar, and lighting people, and brought to you by Love 101, the family station. Next week, Monday.